everyone takes this exam and is like, oh, I gotta pass, I gotta pass, I gotta pass. But content, yes, there's no getting around content, period. Okay, there is no getting around content. But there's certain test taking strategies, there's certain things I'm going to teach you that are going to lower your anxiety and not make you feel as overwhelmed walking into this exam. And that's important. That's equivalently as important as knowing your content. So, what do I mean by that? I found that there are 5 types of questions. Now, why is this? Arguably, now this is probably the most important thing that I feel you should know. If you get into an exam and you're going in with the mentality of how many questions, you're taking all 145. Okay, you're taking all 145. But if you take a step back, you're like, dang, 145 questions. That's a lot of questions. And then you've got your Q banks that you're using. If you learn that there are 5 types of questions and you can identify them, your approach to them will completely change. Now you're not looking at 145 questions. You're saying, all right, question number 1, oh, this is one of the 5 types of questions. This is my approach to it. So now what that means is, let's figure out what I mean by the 5 types of questions. So obviously, when I looked at the poll, most people are probably going to be intimidated by our select all that apply, right? With select all that apply, you have to realize this. And those of you that have been in my group studies, my personal group studies, I've taught you this, and it's on demand. And I've taught you that there's really 4 things a select all that apply is going to ask. And what are those 4 things? Risk factors, signs and symptoms, education, or a concept. That's it. Those of you that have been in my group study, and we do practice questions, now I'm going to show you this. How many times have we gone to a select all that apply, and tell me if any of them have not fallen into one of those 4 categories? Not once. Not once. Not once have I pulled off a select all that apply that wasn't risk factor, that wasn't signs and symptoms, that wasn't education and concept. So we have to understand that we're looking at certain things. So as I do a practice question with select all that apply, let's find one as a matter of fact. As I go through the 5 types of questions, let's look at risk factors. RF is risk factors. So I do abbreviate. This is how you'll get it. And oh, Erica, I didn't make you co-host. Sorry. Sorry about that. Thank you. So, all right. Let's look at a select all that apply. Look, we just randomly chose one, correct? And I chose high yield topics. So that way you're not only are you gonna see these types of questions, but you're also going to learn about high yield topics while we're doing this as well too. So it's kind of a win-win situation. All right, select all that apply. So now we always use the method, and the method is in order for us to stay organized, okay? Our thought process organized and to take control over the question. So those of you that don't know, and it's in the quick tips, okay? The method is in the quick tips. So the first thing you want to do is read the last part first. Sorry, my handwriting is so bad. So in this situation, well, it's just one long question, right? So all we've got to do is say, hey, which intervention should the nurse include when caring for a client who has had an endovascular repair of an abdominal aortic aneurysm? Whoa, wait a minute. Interventions of an endovascular repair of, okay, it's just a AAA, right? They're just trying to throw in extra words to kind of scare you. But look, of select all that apply, what do you think this becomes? Which one of the 4? I would say I would agree. I would be okay with concept, but I'm going to go with education over concept because we're going to educate them how to care, right? This is education, how to care for somebody that just had a AAA. Now, those of you that are in the course, have I taught you about AAA? I have. And we'll notice that, sorry, I will make the screen bigger right after this question. Thank you for reminding me, I apologize. So read the last part first, and then with select all that apply, we start from the bottom and we make a decision, okay? In my other ones, we compare. In this, in select all that apply in the method, we check. So now this person just had an abdominal aortic aneurysm repair, right? And I've taught you 5 centimeters and above, we're putting in a stent. 5 centimeters and below, serial abdominal ultrasounds, right? I taught you about risk factors, right? So I just told you. Now look at how many questions. I haven't even gotten into this question yet, but this is how I want you to learn. I'm talking about AAA. If I tell you that above 5 centimeters, we're putting in a stent, and below 5 centimeters, we're going to do serial abdominal ultrasounds, well, what type of a question is that? It's a freebie. Either you know it or you don't, and we'll get into that type of a question. If a person has a rupture or ASH post-op, it becomes a prioritization question. Or an infection, prioritization question, right? So now I'm showing you how many different ways I can ask about just one topic. What are some risk factors for a AAA? Age, smoking, male. What type of a question could I ask on that? How about a risk factor? Risk factors. How about a select all that apply? Just one topic. I've given you about 5 different ways I can ask questions and 5 different types of questions, right? So now you have to study like this. That's the only way you're going to get through these board exams. So now we start with number 5. We palpate and monitor for peripheral pulses. Well, if I just did an abdominal aortic aneurysm, and where does that lie? This is my depiction of an abdomen. Okay, where does that lie? Where? And there's another question right here. Where is the abdominal aorta? Hot spot, right? All of that, because it goes through the abdomen, and that is your abdominal aorta. I just gave you 5, 6 questions just on one topic alone. You don't think the boards are going to do that? Of course they are. Of course they are, because that's how I would ask it. And when I say those words, that's how I would ask it. That's a test maker. I want you to start thinking like me. I want you to start thinking like me, because just off the top of my head, I just thought of 5, 6 different questions, right? So now we've got the abdominal aorta going down. Well, it's going to go into the periphery. Will it not? Absolutely it will. And if it goes into the periphery, do you think if a person is hemorrhaging out that we're going to see peripheral pulses? No. So do you think we want to monitor them? Yes. Monitor fluid intake and urine output. Hold up. Anybody post-op, you think you're not going to do that? Now, measure chest tube drainage. Wait, did we do anything with the chest? No, we didn't. So am I worried about the chest tube? There's no chest tube in there. They're trying to get you with what? The fact this person could bleed, right? So they're trying to get you. Check for bleeding at the groin puncture sites. I told you, when they give you an anatomical location, age, weight, time, gender, they're giving it to you for a reason. Now, I know there's people out there that say it doesn't matter. I'm telling you the complete opposite, okay? So if you've heard that, you can go with that. I'm telling you, and my students will tell you, pay attention. It makes the world of a difference. So now, where do we go in to do an abdominal aortic aneurysm repair? Well, we do it with a stent. So we go in through the femoral artery, right? So now I'm putting in a stent. So am I going to check the groin for bleeding? Yes, because which one of the 8 or post-op are we worried about happening? And again, I'll talk about this in tutorials. We're worried about hemorrhaging, right? So, and I'll talk about this the very next type of question. Assess abdominal incision every 4 hours. But wait a minute, did I just say we went in through the abdomen? No, we went in through the groin. Is there anything in here that I've not taught you? No. Every single thing in here I've taught you. So nurses, do you think we got this correct? And this is a select all that apply. And the first one that we came across, and everything in here, those of you that have been in the course, I have taught this, right? So let's see if we got it right. 24% of people got this correct. Only 24%. 24%. If you are getting this type of a question right, you're passing. You're passing. But look at the mentality. Look at every little word. I looked at, I mean, that's just to me, I'm like, wait a minute, when do we post-op ever not check that? I don't know. Does it have anything to do with the abdominal aorta? No, but it's something that we do, right? Let's do another select all that apply. I want you to see a couple more. So why not abdominal incision? Because when we go into do a stent, we actually go into the femoral artery, and then the stent will expand and it will keep the aneurysm from rupturing. We never cut them open. Because what else do we know about abdominal aortic aneurysm? How are you gonna notice it first? How are you gonna probably palpate a bulging mass? And what are you never gonna do about that? Once you palpate it once, what are you gonna do? You're not touching it again. And if you listen, what are you gonna hear? Brewy, what's going on? Palpable mass, brewy. What are we gonna order? An ultrasound. Is that another select all that apply question? How about a further teaching, further intervention question? Which of the following statements by the graduate nurse, because that's what they like to use, graduate nurse or the new nurse, right? Needs further teaching, further intervention. Oh, I felt this mass in the abdomen. Let's go check and feel it again. That's a further teaching, further intervention. That's a wrong statement. I just gave you guys like 8 questions. Think about that on one topic. Let's keep going. Select all that applies. Let me make the screen bigger. Sorry about that. Yeah, you could do meds. Absolutely. Right? So